Thank you for joining Understanding HIPAA Compliance, Physical Security. We will be starting shortly. We will wait a few more minutes for others to join us. Thank you for joining Understanding HIPAA Compliance, Physical Security. We will be starting shortly. We will wait a few more moments for others to join us. Thank you for joining the BioMedix webinar, Understanding HIPAA Compliance, Physical Security. My name is Mike Hamilton, the Associate Product Manager for TrackNet PM at BioMedix, the sponsor of this webinar. Our speaker today is Dr. Michael Brody. Dr. Michael Brody is a nationally recognized speaker presenting on health information technology and electronic health records. He is a featured health information technologies writer for Podiatry Management Magazine, APMA News, and the PICA newsletter. Dr. Brody received his DPM at the New York College of Podiatric Medicine, is involved in resident education at VAMC Northport, and has been in private practice for over 20 years. We do have 3 housekeeping notes. If you have questions, please type them in the question box to your right. We will have time at the end of the webinar to answer some of your questions. There will be survey questions at the close of the webinar. Please take the time to answer them. We appreciate your feedback, and it will help shape future webinars. After the webinar, if you do have any questions that have not been answered, you can email info@biomedix.com. And at this time, I would like to introduce Dr. Michael Brody.
Thank you, Michael. Welcome to our continuing series of HIPAA compliance and HIPAA security. When talking about HIPAA security, we need to remember there are 3 aspects to HIPAA security. We have administrative measures, and those are the policies and procedures you have administratively to ensure you have security. You have technical measures, which are what you do physically to your computer network to ensure security, and then you have physical security. Today's lecture is about physical security, which are the measures you're going to take for your physical location to ensure that the medical records that you have in your office are secure. Now, when we talk about security, and this is true for whether it's technical, administrative, or physical, we have 2 types of measures. We have addressable and we have required. A required item is something that you must do. There really is no wiggle room. You have to implement that particular measure. An addressable measure is a measure that you must address to the best of your ability. When you look at the rules state that you must meet the HIPAA regulations to the level that you have, to the level that you can within your organization. So it is known as what's scalable. So you are required to do what is reasonable and within the resources of your practice. Now, when we talk about addressable items, if you are going to do something completely, you describe how you're going to do it and why you're going to do it. If you're going to do something in a minimalistic fashion because it's beyond your resources, you will discuss what you're going to do, why you're going to do it, and why your resources limit you to how you're going to meet that measure. Your manual has to be properly customized to reflect what you are doing and what is within your resources. Now, the first group of measures are known as facility access controls. These are the policies and procedures that you're going to use in your office to ensure that only people who should have access to your facility and to the technology, computers, backup disks, etc., in your facility are set up properly. You want to make sure that if they are not supposed to have access, they don't, and if they are supposed to have access, they only have access to the items that they should have access to. For example, not everybody in your facility or in your practice should have access to the server. They may only have access to workstations where administrators would have access to the server. So you're going to set up controls to both in policy and in physical items to ensure that people don't access what they should not access. Now, within this group, the first thing you have are your contingency operations. You must have a contingency plan in place. Now, your contingency plan is what gets activated should there be some sort of physical disaster to your office. That physical disaster could be a fire, a flood. It could be a complete power outage where you have no power in your facility. Now, this is an important issue because one of the aspects of HIPAA are that you have to keep your medical records available. If your facility, if your practice is no longer functional, you still have to be able to access your medical records to be able to communicate with and provide care to your patients. So you must have a contingency plan to allow you to access this data. That contingency plan could be anything from as simple as a laptop with your EMR software loaded on it and loading up your most recent copy of your backup to renting space at a disaster recovery center. What you do there, once again, addressable, you address what is appropriate and what you can do within your resources. Once you have your disaster recovery plan in place or your contingency plan in place, then you have to decide who can activate it and who has access to that laptop or to the disaster recovery center, and then you determine who can do what. So this is where you have your contingency operations and you're limiting who can access it and who can implement your contingency plan. The next item is your facility security plan. This also is addressable. Obviously, you want to have security in your office because you want to make sure people don't break in, people don't steal things from you, but you have to have security for your data. Your security plan will discuss what your physical security is. This could include locks on windows, locks on doors, motion sensors, video monitoring, whatever you do. And what you're supposed to do is what is reasonable for your organization. So if you have the ability to have remote monitoring of alarms, such as fire alarms and burglar alarms, and it is not expensive, then it's reasonable for you to do that, and you should do it. If that is not available where you physically are, then it's not reasonable to do because it's not available. Do you need to have video monitoring? That's really not necessary for a small practice. It's outside of what you would need, and the cost is prohibitive. But to have door and window alarms on every door and every window is reasonable. So what you have to do is look at what you can do and what is reasonable based upon your resources. And you need to do what's reasonable based upon your resources and document what you have done. Once again, this is addressable because you have to have a security plan, you have to have security, but to what level really is based upon what is reasonable for you. The next item is your access control and validation procedures. Your access control and validation procedures are the procedures and policies you follow to decide which of your employees have access to what aspects of your computer system. For example, who is allowed to touch and log into the server, who has administrator accounts, who has secretary type accounts, who has doctor accounts. In addition, you're going to want to monitor who else has access to your computer system. You may have hardware and IT vendors who work on your system. If you are giving them access, you have to make sure that they are monitored and their access is under your control. Therefore, when you have someone working on your computer systems, especially if they're working on computers with patient information on it, you want to have somebody for your practice actually physically there with them. In addition, you want to make sure that you have business associate agreements with anyone who is going to be touching your computers and may have access to your patient data. The next item is records maintenance. Now this once again is addressable because you can do it in a manner that is appropriate and works well for you. But your records maintenance, you want to keep track of time, date, and repair of any modifications to your office. If you're changing the logs, when they were changed, who changed them, and the details of why they were changed. You want to have a complete description in this records maintenance log, and you want to see and say why it was done. If you're changing a lock because the keys are worn out, fine. If you're changing a lock because an employee left that under, shall we say, unpleasant circumstances, and you want to make sure they didn't make a key, that's fine. But you have to record what you've done. So whenever any